Dr. Gupta Jain. I am a developmental occupational therapist, and today I am here in front of you all to teach you some magical finger movements. Yes, I have termed them magical finger movements because these are very simple hand and finger movements which will develop so many skills that you will feel that these are actually magical finger movements. So these movements will help your child develop the small muscles of their hands, so that will indirectly help them develop their fine motor skills like handwriting, coloring, cutting, buttoning, zipping, lacing, and all the fine motor tasks which you do with your hands. And moreover, these movements will help your child develop visual motor skills, visual perceptual skills, motor planning, visual memory, auditory processing skills, visual processing skills, directionality, spatial relationships. Oh, so many skills are developing with only few simple movements. So let's get started. So first of all, we will start with a warm-up clap. Then back, front, back, front, back, front, back, front. You will see that your child may have difficulty in doing these simple movements, but keep on trying and the child will start doing all these things. Yes, front, back and front, back. And these movements also help them develop coordination, eye-hand coordination, as well as hand-to-hand coordination, which we also call as bilateral integration. Yes, now we will do some front and back movements. These front and back movements are developing your child's coordination, and they are also developing their spatial relationships and their proprioceptive input as well. They are getting kinesthetic input. Yes. Okay, so whatever the hand is at back, we will close that hand. Now simple: close, open, close, open, close, open. One hand close, one hand open, one hand close, one hand open, one hand close. Yay! Alternate hand movements. Both hands are doing different actions, yet they are doing it in synchronization. So it will develop the integration of two hemispheres of the brain. Yes. So now like this, two hands are joining each other, then opening up, and make sure that their hands open wide up, so that the intrinsic muscles of the hands get stretched completely. Yes. And then they can also do this. The lower hand is closed, upper hand is tapping on it. Yes, like this. Now we will do some finger movements. So join your hands like this, do the thumb movements. Yes. Now roll your index fingers. Now roll your middle fingers. Now roll your ring fingers. Then roll your little fingers. Yes, this is called as finger isolation, and believe me, it is actually not a very easy task. It is difficult for most of the children, so you have to practice it with your child. So, and with finger isolation, there are many fine motor tasks gets very easy actually. Then we can do finger isolation like this also. Raise one by one pair of the fingers like this, and now along with raising, they need to point to each other like this, one by one pair of the fingers. Yes. Now one by one finger roll like this. Yes. Now finger touches. This you can also do by just naming the finger, and the child will just touch those fingers. For example, you name them ring finger, little finger, index finger, ring finger, middle finger, little finger. So if the child is just doing it by listening to your instructions, the child is gaining their auditory processing skills. And if the child is doing while you are doing, and just by watching they're doing it without any verbal instructions, they are improving their visual processing skills. And when you just make some hand movements or finger movements and they just copy it after you are done with it, then they will develop visual memory skills. So there are a lot more to do with these finger movements, and there are a lot more to add on to these. If you feel that your child lacks in such movements and they require some help, then please contact your occupational therapist and they will definitely help you, and your child will develop so many skills with simple movements. Okay, bye.